Hello and welcome. Today we're delving into a complex condition that can significantly impact kidney function: amyloidosis affecting the urinary system. We'll explore what it is, how it develops, its symptoms, diagnosis, treatment options, and what the future holds for those affected. Let's get started. Amyloidosis isn't caused by a single thing, it's more about what's happening in the body. It occurs when abnormal proteins, called amyloid, build up and deposit in various organs and tissues. These proteins aren't typically found in the body in that form, and their accumulation can disrupt the normal structure and function of the affected organ. In the context of the urinary system, these amyloid deposits can heavily impact the kidneys, which are vital for filtering waste from the blood. The specific cause of amyloid protein formation can vary, depending on the type of amyloidosis. Some types are associated with chronic inflammatory diseases, certain cancers like multiple myeloma, or hereditary factors. In some cases, the cause remains unknown, termed idiopathic amyloidosis. The kidney's remarkable ability to filter waste depends on its intricate structure, particularly the glomeruli, which act as tiny sieves. In amyloidosis, amyloid fibrils infiltrate these delicate structures and other parts of the kidney, like the tubules and blood vessels. These deposits thicken the glomerular basement membrane, reducing its ability to effectively filter waste products. As amyloid builds up, it physically damages and displaces normal kidney cells. This process impairs kidney function in several ways. It can lead to proteinuria, where the kidneys leak protein into the urine. Over time, the buildup of amyloid can cause chronic kidney disease, which progresses to kidney failure. The kidney's ability to regulate fluid and electrolyte balance is also compromised. The exact mechanism by which amyloid fibrils cause cellular damage is still being studied, but it's believed to involve direct toxicity and disruption of cellular processes. Unfortunately, accurately determining the precise incidence and prevalence of amyloidosis affecting the urinary system is challenging. This is because amyloidosis is relatively rare, and the symptoms can mimic other kidney diseases. Therefore, the rates might be underestimated. However, it's known that certain populations are at higher risk. These include individuals with chronic inflammatory conditions like rheumatoid arthritis, people with multiple myeloma or other plasma cell disorders, and those with a family history of hereditary amyloidosis. The prevalence also varies geographically, with certain genetic mutations being more common in specific regions. Understanding the risk factors and epidemiology is vital for early detection and management. The signs and symptoms of amyloidosis affecting the kidneys can be subtle at first and often mimic other kidney diseases. One of the earliest and most common signs is proteinuria, or protein in the urine. This can lead to swelling, particularly in the ankles and feet, which is known as edema. As kidney function declines, patients may experience fatigue, weakness, and loss of appetite. High blood pressure or hypertension is another common symptom. Eventually, if left untreated, the patient may develop symptoms of kidney failure, such as nausea, vomiting, shortness of breath, and changes in urination patterns. It's important to remember that these symptoms can be caused by other conditions as well, so it's crucial to seek medical evaluation for accurate diagnosis. Diagnosing amyloidosis affecting the urinary system often requires a combination of tests and procedures. Initially, urine tests are performed to detect proteinuria. Blood tests can reveal abnormal kidney function, such as elevated creatinine and blood urea nitrogen levels. An important diagnostic step is a kidney biopsy, where a small sample of kidney tissue is removed and examined under a microscope. This biopsy is stained with special dyes, such as Congo red, which specifically binds to amyloid deposits and allows them to be identified. If the biopsy shows amyloid, further tests are conducted to determine the specific type of amyloid protein involved. This information is crucial for guiding treatment decisions. In some cases, biopsies of other tissues, such as the bone marrow or fat pad, may be performed to look for systemic amyloidosis. Amyloidosis isn't a single disease, but rather a group of conditions caused by different types of amyloid proteins. The most common types affecting the kidneys include AL amyloidosis, also known as primary amyloidosis, which is associated with plasma cell disorders. Amyloidosis, also known as secondary amyloidosis, is linked to chronic inflammatory conditions. Hereditary amyloidosis is caused by inherited genetic mutations. ATR amyloidosis, formerly known as senile systemic amyloidosis, is caused by the transthyretin protein and can affect various organs, including the kidneys and heart. The specific type of amyloid protein determines the treatment approach and prognosis. The primary goal of treatment for amyloidosis affecting the urinary system is to slow down or stop the production of amyloid proteins and to manage the symptoms of kidney disease. Treatment approaches vary depending on the type of amyloidosis. For AL amyloidosis, chemotherapy or stem cell transplantation may be used to target the underlying plasma cell disorder. For amyloidosis, the focus is on treating the underlying inflammatory condition. For ATTR amyloidosis, medications that stabilize the transthyretin protein or gene silencing therapies can be used. In addition to these specific treatments, managing kidney disease symptoms is crucial. This may involve medications to control blood pressure, reduce protein in the urine, and manage fluid retention. In advanced cases of kidney failure, dialysis or kidney transplantation may be necessary. Unfortunately, there is no known way to completely prevent amyloidosis. However, certain measures can help reduce the risk of developing some types of amyloidosis. For example, effectively managing chronic inflammatory conditions can lower the risk of amyloidosis. Regular checkups with a healthcare provider can help detect early signs of kidney disease or other underlying conditions that may contribute to amyloidosis. If you have a family history of hereditary amyloidosis, genetic counseling may be recommended to assess your risk and discuss potential screening options. Early detection and management of underlying conditions are key to preventing or slowing the progression of amyloidosis. The prognosis for amyloidosis affecting the urinary system varies depending on the type of amyloidosis, the extent of kidney damage, and the individual's overall health. Early diagnosis and treatment are associated with better outcomes. Advances in treatment options, such as novel therapies for AL and ATTR amyloidosis, have improved survival rates and quality of life for some patients. Researchers are actively investigating new approaches to diagnose and treat amyloidosis, including developing drugs that can directly break down amyloid deposits. Ongoing clinical trials are exploring new therapies that target specific amyloid proteins and prevent their accumulation. While amyloidosis remains a challenging condition, ongoing research and advancements in treatment offer hope for improved outcomes in the future.